Good afternoon. I would certainly like to thank the Friends of Medicare for organizing this event. I would also like to welcome from Calgary people who took the time to come up today to defend Welcome to the Legislative Assembly, and we appreciate your support to see if it would even work. They've spent an additional $1 billion since this time last year when they fired the regional health authorities in transition costs. But yet they tell seniors that you're going to have to pay more for prescription drugs. They tell other seniors you're going to have to pay more for long-term care. They cannot plan.
That's right.
And it is the government's mismanagement that has caused this crisis in public health care, where emergency rooms are overcrowded. People can't access hospitals. People can't find a family doctor. And it has to stop. And the only people that can stop it are you, the taxpayers that are paying for the system. Now, there has been a lot said already this afternoon about Mr. Leifert. And certainly Mr. Leifert has a very forceful direction where he wants to take health care. But the third floor, not the third way, the third floor here is the Premier's office. And Mr. Leifert is taking his directions from Mr. Stelmach. And please never forget that. It's Mr. Stelmach and his advisors that we have to convince that public health care is part of the social fabric of this province. Not only do we all benefit from it, but businesses in our province, they also benefit from public health care. And this summer, just like before Christmas, whenever the initial announcements were made, when everyone was getting ready for the Christmas holidays, this summer is when this government plans to make major changes to how hospitals are funded and how hospitals are going to function. Which hospitals are going to remain open, which are going to be closed or reduced to just part-time service. That is coming this summer. And again, it is up to you to help us convince the government that this is the wrong way. And in conclusion, I would like to remind you again that it is Mr. Stelmach that's calling the shots, and it's Mr. Leifert that's walking from the Premier's office and carrying out those orders. And when you look at the arguments that they make, that this system is not sustainable, it's not true. What is not sustainable is the mismanagement by the Conservative government of their health care. And finally, I would like to remind you that, contrary to what the Conservatives always say, Alberta is not an aging population. Seniors have not driven up the cost of health care. Conservative mismanagement has. The average age of Albertans, particularly in the big cities, Edmonton and Calgary, is 36 years or less. We have about 10% of the population over 65. And please do not tolerate it whenever Mr. Stelmach and Mr. Leifert and all the Conservative caucus blame seniors for what is wrong with our health care system. It's their mismanagement. It's not anyone's illness. And if we don't work together and try to prevent this third wave from taking over, the thickness of your wallet will determine how quickly you get access to health care. And that's not right. It's not Canadian. It's not Alberta. Thank you very much.